And then we were going to talk about I'm just going to go ahead and show people this device. It's been a game changer for me. So I want people to stick around to hear about that because it can really change people's lives, and it changed my life.
There's mine. I don't leave home without it.
Hi, everyone, and welcome back to the Mastering Mast Cell Activation Summit. I'm your co-host, Beth O'Hara of Mast Cell 360, and I am delighted and honored to have with us Dr. Roger Billica. And I know that you are in Colorado, near Loveland or in Loveland?
Fort Collins.
Fort Collins.
Subject, but I've always been a person who asks why or why not. And so even in medical school, I was involved with putting together a class called Alternative Approaches to Health and Healing. And I went into family medicine, got my MD, did family medicine. Then I joined the Air Force and did aerospace medicine, and then went to the NASA space program. And my official title was Chief of Medical Operations. But during the 90s, I was responsible for integrating with all the countries who would become our partners in the International Space Station, how as an international medical responsible group, how are we going to practice medicine in space? And there were no standards, there were no rules, there was nothing. So with the Russians and the Japanese and the Europeans and the Canadians and us, we spent a lot of time working all that out. But what that did was expose me to different approaches, different ways of looking and problem solving, and different paradigms for health. And it exposed me, to frequency and electromagnetic therapies and homeopathy and herbal medicine and so on, and really opened my eyes.
And then we were going to talk about some really revolutionary devices. These are not the stickers, the pennants, the harmonizing things that are making some people feel worse. And I'm not finding that they're having as good of an impact as we need. But we're going to talk about some devices, and I'm just going to go ahead and show people this device. It's been a game changer for me. There's a scalar energy device that does really work, and we have published studies on this. So I want people to stick around to hear about that because it can really change people's lives, and it changed my life.
There's mine. I don't leave home without it.
I keep this sitting right on my laptop, and then when I walk away, I actually put my hair up and I clip it in my hair clip, and it takes my migraines away. It feels wonderful. So I can't wait to get the pendant and some of the other ones. But
yeah.
Well, let's start with some basics and background of EMFs, and I'm going to pull your slides up here.
Okay. So, to help people understand, let's look at this list of, is this sensitivity? Is this illness? That becomes let's just go ahead and throw it all up there. People can be looking at that. But I mean, look at this list, folks. This is the list that everybody struggles with, and everybody goes to their family practice doctor regularly. If you're a healthcare provider, how often I'm not sleeping well, I'm tired, I have headaches, I have brain fog, I feel anxious and depressed, my heart's beating funny, neuropathy, ringing in the ears, common symptoms. Now, there's other things that could cause it, absolutely. So you need a good diagnostician, but as you're going through the list of what could be going on, you absolutely need to think of electromagnetic radiation sensitivity. Right. So here's some actual, quote, diseases as opposed to toxicity that have been linked to electromagnetic radiation effects. So decreased production of certain hormones, thyroid, certain tumors, certainly breast tumors, breast cancer. For that reason, I guess this is okay to say, I'm not a fan of mammography. I would much rather people do thermography, do a heat temperature sensitive scan, because there is evidence out of Europe that, basically, mashing the breast tissue and radiating it is not particularly a good thing to do to it.
I'm so grateful you said that, because that's a huge question that people come in with. And it's a sensitive topic, and it's a very political topic.
Yeah. And then infertility, which is on the rise, and particularly male infertility. And then the autism spectrum disorders. And I'm sure there's more, but these actually have, published research behind them. So we can list these in confidence. So then the last one here is this technology out of Spain called Pranan. and it neutralizes or counteracts the exposure without altering the EMF. It's actually creating a whole different energy field called scalar energy, which is not electromagnetic frequency. It's a totally different phenomena. It was first measured by Tesla. In fact, some people call it Tesla field, some people call it 0 point, but it's a fascinating energy that is the energy of the universe. It actually moves through the fourth dimension of time. It's everywhere simultaneously, and it explains how quantum physics can exist. So it's fascinating, and there's emerging information on it, and it turns out there are ways to create a scalar energy field. And what it turns out is the scalar energy is much, much stronger than the EMF. So if you protect yourself with the scalar field, the EMF is not strong enough to harm you. It doesn't block the EMF, it doesn't stop the EMF, it doesn't change the EMF, but it protects you. And there's good research on that. So let's look at some of these. So like I said, this is out of Spain, and they're just now becoming available in the United States. It has some fascinating research on them. I've already talked about briefly how the scalar field works. So they're totally passive devices, and most of them are quite small, but they also have larger ones that can actually protect areas in your house. So it kind of creates a dome of a scalar field around. I think they go out about 60 feet in each direction. So, we have this in our office and in our home. And then when I leave, I just put one of these in my pocket. No power, no batteries, no maintenance, because they're just passively creating this scalar field. And that's their technology. I know a little bit about it, but not enough to explain exactly how it works. But I know that's what. So there's 6. There's the little pocket device I just showed you. There's a biospace tower for rooms and houses and things that I just showed you. And there's ones to go on your phone. And again, these do not block the EMF. They do not change. They do not filter it. The phones still work. What it's doing is protecting you from the EMF that's occurring. This is a brand new one that's just coming out on travel. That's for use if you're riding in electric cars, airplanes, going up in altitude, these sorts of things. And then they also have a pendant and a necklace jewel that you could wear around your neck. So those are currently what we have available. They all work the same way. And I think you told one story. I took this to a conference on frequency medicine where I was speaking a few months ago, and I brought samples to show people, and of course people wanted to buy them. But one of the ladies bought I don't know if it was the pendant or the jewel, but the next morning she comes running up to me and said, "I've got to tell you, I put that on, and for the first time in several years, my constant dizziness went away, just gone." And she was so excited. And I said, well, that tells you that dizziness was at least in part caused by your sensitivity to EMR.
Thank you so much, Roger.
Thank you for the opportunity.